We welcome you to our module Rheumatoid Arthritis, Sacroiliitis, HCC 40 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of rheumatoid arthritis, sacroiliitis. At the end of this module, the learner will be able to define sacroiliitis and its cause, discuss the criteria for the documentation of the disease, identify the different tests used to plan a patient's care, review the example of the assessment and plan for the disease. Sacroiliitis is linked to spondyloarthropathies, a group of diseases, and it can be defined as a sacroiliac joint dysfunction, which seems to be in a state of altered mechanics. Sacroiliac joints are found at the lower part of the spine connecting the pelvic area near the hips. Sacroiliitis is a hallmark of ankylosing spondylitis and may also be seen in the course of other rheumatic and non-rheumatic disorders, such as psoriatic arthropathy, familial Mediterranean fever, Behçet's disease, hyperparathyroidism and others. It is a difficult disease to diagnose as it can be mistaken with other forms for other causes of back pain. Other causes of sacroiliitis include osteoarthritis, traumatic injury, infection or even pregnancy. The major symptoms of sacroiliitis include pain and stiffness in the buttocks and lower back, along with a mild fever. The criteria for the documentation of sacroiliitis includes a physical examination, radiology and a plan of care. During the physical examination, the examiner should check the presence of positive maneuver testing and radiology reports as well as difficulties with activities of daily living and any safety concerns. MRA, CT scan, and some X-ray reports are the definitive support to confirm the condition is present. Thirdly, a plan of care should be mapped out with a linked medication or actions such as physical therapy, exercises and assistive devices to treat the condition. There are 5 tests which the examiner can perform on the patient. Namely, the thigh thrust test, Mendel's test, sacral thrust test, compression test and Faber figure 4 test. Response to 3 or more of these tests is indicative of sacroiliitis. Let us look at these tests in brief. Thigh thrust test. The subject should be in a supine position, with contralateral leg extended. The examiner should stand next to the subject and he or she should flex the affected leg, contralateral, approximately hip at 90 degrees. The knees should remain relaxed. Graded force pressure, or a posterior shearing stress is to be applied through the long axis of the femur, with one hand underneath the sacrum and the other one around the knee to give pressure. Mendel's test. The subject should be in a side-lying position, with the affected side down, and back towards the edge of the table. The affected, table-contacting side hip should be flexed to the abdomen and the knees should be flexed. The examiner should stand behind the patient and put one hand over the ipsilateral gluteal region and iliac crest, while the other hand should grasp the semi-flexed ipsilateral knee and should lightly force the leg to extension. Sacral thrust test. The subject should be prone, relaxed and semi-abducted, while the examiner should stand behind the subject, close to the feet at the lower edge of the table and put his or her hands over the sacrum and apply interior pressure to the sacrum. Compression test. The subject should be in a compression side-lying position, with the affected side up, close to the side of the table and back towards the table. The hips should be flexed approximately at 45 degrees, while the knees should be flexed at 90 degrees. The examiner should stand behind the subject with his or her hands folded over the anterior edge of the iliac crest and apply downward pressure. Faber figure 4 test. The subject should be supine. The tested leg should be placed in a figure 4 position, where the knee is flexed, and the ankle is placed on the opposite knee. The hip should be placed in flexion, abduction and external rotation, the acronym of Faber. The examiner should apply posteriorly directed force against the medial knee of the bent leg towards the tabletop. A positive test occurs when groin pain or buttock pain is produced. Due to forces going through the hip joint as well, the patient may experience pain if the pathology is located in the hip as well. If there are no longer symptoms or treatment, then this diagnosis can resolve and become a history of. The ICD code for sacroiliitis, not elsewhere classified, is M46.1, HCC 40. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note. Patient name: Craig McDermott. Date of service: January 21, 2019. Date of birth: March 27, 1989. Assessment and plan. Sacroiliitis is evidenced by positive SI joint pain in response to thigh and sacral thrust tests and Faber's maneuver. CT indicates SI arthritis. Patient has pain on sitting and bending. Refer to physical therapy. Ibuprofen is prescribed. Return to office in 3 months. We have reached the end of our short refresher course on rheumatoid arthritis, sacroiliitis. We gave you a short introduction to the disease, identified the various tests involved in the diagnosis, noted the ICD code for the disease, and finally reviewed the assessment and plan for sacroiliitis. Thank you for joining us.